Health system is celebrating 50 years of heart surgery, and joining us this morning to talk about how that procedure has changed over the years is cardiothoracic surgeon Dr. Prem Rabindra. Good morning, Dr. Rabindra. Thanks for getting up with us.
Good morning, and thanks for having me in the program.
This is such an interesting topic just because, I mean, think about just even the way you reach the heart has changed dramatically over the last 50 years.
Yes, that is very true. Ever since the invention of the heart-lung machine in the 50s, heart surgery has changed dramatically. 50 years may seem a long time since starting heart surgery here at Gundersen Lutheran or Gundersen Health System. But over the years, the procedures themselves haven't necessarily changed. The basic principles haven't changed, but technology has kind of caught up and advanced so much in the last 50 or more years that we're now able to do things slightly different, and even through smaller incisions, which enable our patients to recover sooner.
I wanted to ask you about that. What was recovery like 50 years ago compared to now? And what were outcomes like?
Good question. From what I read and things, back when heart surgery started, patients would be in the hospital over a week sometimes. And after major heart procedure, like open heart surgery, they would be on a ventilator asleep sometimes for a day or two. Nowadays, patients are awoken in the operating room most of the time, and they're off the ventilator machine and essentially sitting there a day of surgery in a chair. And by the next day, they're mobilized. And, even the post-operative care, nursing care, exercise physiology, all these things have advanced over the last couple of decades to the point where everything is streamlined, and it's all geared towards a better recovery or a quicker recovery. It's the early mobility of patients.
Mm-hmm. And outcomes, do more people survive, or are they cured, so to speak?
Yes. The mortality rate for, say, bypass surgery, for example, in the country, it's down just below 2% nowadays.
Wow.
And again, it's all because of not just technology and advances in the procedures themselves, but better data collection. And, being able to see trends and change things along the way, adapt, the procedures or postoperative care, for example, to kind of adjust. And the outcomes have tremendously improved over the last several decades.
Well, of course, no one wants to undergo a heart procedure. So what can folks do simply beginning today to protect their heart health?
Well, nowadays, there's a lot of things you can do. When we talk about having a bad heart, there's several things. There's coronary artery disease, there's valve disease. Just those two things, two completely different things. But I think nowadays, I'd encourage people to maybe do more research. I mean, we have all sorts of resources available nowadays through the internet. You could type in bypass surgery, and a host of things will pop up. You could sit there and read for a half hour, and you'll be a whole lot better off than you were before you even looked there, So I think that's the first thing to do. And then certainly check in with your doctor, especially if you have anybody in your family that have had heart disease. You already have a family history. That's one of the biggest things that you can't change. So now what do? There are several other factors that are related to heart disease that you could probably change. Diabetes, hypertension, stress, lack of exercise, that are all related or contribute to coronary disease. So these are things people can work on.
All right, Dr. Rabindra, thank you so much for joining us, and congratulations. I know you haven't been practicing medicine that long, but we still congratulate your efforts here in La Crosse.
Well, thank you very much.
Thank you. We'll be right back.